I think as healthcare professionals, there's a lot in it for us because that's the care that we really want to deliver.
And we're all like-minded individuals who want the best outcome for the most vulnerable of our populations.
Parents often say that if they have to bring their child to a hospital or a medical setting, it's their worst nightmare because they expect that their child's going to be very, very anxious, upset, and maybe have meltdowns. And so everybody's afraid. The family's afraid, the children are afraid. But the physicians here and the people who work with the physicians are wonderful. They are so sensitive to children and to children developing, facing difficult circumstances. So everybody wants to learn, and that's what's so wonderful about this conference.
There are a lot of solutions around. Many people here share their insights and their experiences so we can learn from each other. So actually what we do now is creating this learning community where everybody can feel safe to share what he does not yet know or does not yet is able to manage well. And so a kind of being humble and having the courage to share that and to learn from each other.
Having the PROSA Excellence Learning Center to be the repository for all of the information, that is something mind-blowing.
Sometimes the small things become the big things. So really the devil is in the detail, and it's all just about the planning that goes into making a journey a successful one. But it's getting to know a child really well and then planning things out in a very organised way so that we don't miss any points that might be the potential trigger that makes that day a difficult day for the patient.
You want to have a trusting relationship, and how do you get that? By being trustworthy. So you keep your promises and do your preparation, those kinds of things. But we can always be challenged. There's going to be things that we are completely unprepared for. But if we have our own grounding well, then I think regardless of what the situation that comes to us, we can handle it a little bit better. But to know that we don't have to be perfect. If there's a skill that you don't have, we work as a team, right? I may not know the answer, but there's somebody else who may.
We, as healthcare professionals, it's really important that we give children some choice and some control when they're coming for procedures. Even small children, even children who we sometimes assume cannot do that. Often there are choices and things that they can choose within a procedure that will make their experience much better. And we know that this can make quite a big difference. So it's just having that brave conversation about how we actually involve children in their care to help us give them the best care possible.
We know that if a child and a parent know what they can expect in advance, they are more calm, they're more trustful, they're more open to collaborate. And so that makes our work much easier.
Listen to what children and parents will tell you, and not so much can go wrong when you deal with neurodivergent children.
We have to understand the differences and the sensitivities in those children, because autistic children are very much more sensitive in a lot of ways than other children might be. They might be overly sensitive to sound, to touch. They are easily fearful of new and unfamiliar situations.
You observe, you engage, and then you look how it worked, and you do it again. You keep on going, and then it's safe, it will work.
All you need is time. Sometimes you need medication, time, the approach, and by reserving this time, you've already done a lot of a job. But how do you show maybe the hierarchy, the hospital leadership, which do need to, they want you to show that it's financially legit. How do you show them that by investing time, in the long run, you probably save money and resources? That's still a little bit tough to argue, but we're doing that every day and pushing the limit every day.
You're controlling the controllables to as much of an extent as possible. We're all human, and you can't control everything. But helping everybody to feel well prepared allows us to maximize the use of our time.
Parents are learning. They need support to learn how to do the best they can. The child is learning. The first time, they don't know what to expect, but if we treat them well, if we prepare them well, they are learning and they will help us. And third party, we are learning. And if you make it a learning meeting, first of all, you can all become competent, you can proceed, but if something goes wrong, which will happen, sometimes it will hurt. Sometimes it will not go like you want. But if you're all in the learning attitude, then you know, okay, we have this experience, but let's learn. What do we learn from this, and how can we change? So my dream is that when a patient comes, that any healthcare professional is equally competent in managing the disease as managing the human being that is in front of him, trying to maintain trust.